You're watching WGAL 8. Now, coverage you can count on continues from the Susquehanna Valley's most watched news team. This is News 8 at 5.
News. Rosie O'Donnell says she is lucky to be here after suffering a major heart attack last week. The 50-year-old comedian and talk show host says she experienced sudden nausea, arm pain, and some other symptoms that led her to do an online search for women's heart attack symptoms. But instead of calling paramedics, she took an aspirin and went to a cardiologist the next day. Doctors then discovered her coronary artery was 99% blocked, known as a widowmaker. She underwent a stent placement to release the blockage and is now recovering at home. O'Donnell says that attack came on after an act of kindness in which she helped the large woman get out of her car. Dr. Ellen Smith, a cardiologist with Lancaster Regional Medical Center, joins us tonight. We're going to talk about the warning signs for women, which so many people sometimes ignore. Let's start with what exactly those signs are, maybe the uncomfortable pressure.
Well, this is common to women and men, but the classic sign of heart attack is a substernal, under the sternum, chest pain, pressure, tightness. Some people describe burning. Classically, they use their fist to describe it, but that's the way the textbooks list it. That's not what happens.
Some of the others too, not just that classic, but pain in the jaw, the arms, the back, maybe.
Pain, I would say, anywhere below the eyes and above the umbilicus can be cardiac. It's more a question of recognizing not just the type of pain, but the pattern. But I've seen patients who've had it in their wrists. I've seen patients who thought they had a toothache. It can be really anywhere. It can be in the back.
Also, isn't there a shortness of breath too, and maybe some discomfort, some nausea?
Nausea, definitely, if it's a heart attack, particularly the kind that come from the bottom of the heart, the right coronary artery. Shortness of breath, yes. Sometimes, not invariable. Sometimes people present just with shortness of breath.
And lightheadedness, I guess, sometimes, and you could toss that off as meaning just about anything these days.
It could be. I mean, it can be. And again, it depends on the type of heart attack. The bottom wall of the heart, if you have a heart attack there, it'll slow the heart down. And if it does that, you can become very lightheaded.
Well, Dr. Smith, let's talk about, too, why women ignore these signs.
Well, I think, and this is purely supposition, but I think there has been a sense until recently that women don't get heart attacks. Women were worried about other things. And so if a woman gets not necessarily chest pain, but if a woman were to be short of breath or if a woman were to be nauseated, she would think it was indigestion. And frequently heart attacks feel like indigestion, which makes it even harder. Wow. But I think there has been a tendency in women to write off the discomfort as something other than cardiac, and I think there's been a tendency in the medical world, not now, but then, to look for other causes in women.
And the good thing, Rosie actually saw her cardiologist the next day after she looked up the symptoms on the internet. All right, Dr. Ellen Smith, a cardiologist with Lancaster Regional Medical Center, we thank you for helping us tonight.